They do not want this conversation happening, so we're doing it live. Hi, I'm Dr. Brian Ardis. I want to personally invite you to something very different, an event called Uncensored with Elizabeth Carson, the banned conversation they don't want you to hear. This is not a typical health talk. This is a live, unfiltered conversation where we will speak openly about topics that are often avoided or shut down. Zero scripts, zero restrictions, just real information and real answers. If you've ever felt like you're not getting the full picture, this event is for you. We're hosting 3 events live in 3 different cities, beginning in Dallas, May 16th, then in Las Vegas, August 8th. Yes, it will be hot. And Miami, December 5th. In-person seating is extremely limited. We are only inviting 100 people per event, and those seats will sell out fast. If you cannot attend in person, don't worry though, because you can join us virtually from anywhere. And every attendee will receive exclusive perks. And if you join us in person, you'll also receive a special gift bag with exclusive items. It will only be seen by those who purchase a ticket and attend live. Get your tickets now at elizabethunlimited.com/uncensored. That's elizabethunlimited.com/uncensored. Join me and Elizabeth Carson for an unforgettable experience. I will see you at Uncensored. Hi, everybody. I'm Dr. Brian Ardis. This is the Dr. Ardis Show, and this entire podcast is titled Natural Solutions to Something That Affects Over 10 million Americans and upwards of 250 million people every single day around the world. And that condition is lymphedema. So this entire PowerPoint presentation and podcast I'm going to walk you through are the most up-to-date medical declared disclaimers about this condition that affects millions of people around the world. What are the therapies? What are the surgeries? What are the complications from those? You're going to see some pretty disturbing images as I walk you through here. I'll warn you before I show them so you can turn your head away if your stomach's a little bit queasy with certain visuals. And then I'm going to walk you through what are the published natural solutions that I would recommend to you. And I'm going to highlight specific medical research studies from around the world that directly tie to lymphedema. Because what you're about to see is that the medical profession to this day still proclaims there is no cure for this issue that demoralizes, leads to amputations, complications of health, and even death to millions in America, hundreds of millions around the world. So if you have ever been stricken by the effects of lymphedema, if someone in your home is affected by lymphedema, if someone in your circle of influence is struggling with lymphedema, if you treat people with lymphedema, this podcast is for you. And remember, as I walk you through the PowerPoint here at the Dr. Ardis Show, going through natural solutions to lymphedema, if you find this information relevant to you or to someone you know, it might provide hope to them. You can go to the resources tab at the drardisnishow.com. Click the resources tab and you'll see little blue windows. Click the window titled Natural Solutions to Lymphedema. When you click it, it provides a Google link to a drive that allows you to download for free any of the PowerPoints that I highlight in any of my podcasts here on the various topics you'll find at the Dr. Ardis Show. You can download that for free, send it to anybody else, or you can just send this video and share the link to this video, and I can walk your loved ones or yourself again if you want to do this as a reminder and just take another deep dive into this topic. Just rewatch this, or you can forward this link to somebody else if you want them to watch it. All right, let's dive into what are the natural solutions to lymphedema. I will bring them up for you here. Then I'm going to blow this up on my end so I can see it easier on these monitors in front of me. All right, natural solutions to lymphedema. If you scan the QR code here, if you're new to the Dr. Ardis Show, scan the QR code if you would like to be updated and notified simply by email on our once a week podcast where I dive, just like I'm about to, into lymphedema, onto various health topics from around the world. And if you want to be notified when those are coming out or anything else we're engaged in here, a new formula, a new product, a new speaking engagement somewhere that you would like to be notified of, this is where you You can scan the QR code, put it in your email so we can notify you. All right, let's define lymphedema. I always like educating people. First and foremost, this is the Cleveland Clinic's website. So if you're not familiar with lymphedema and you just like being entertained, my sarcasm, my knowledge, and then medical research into all things health, sit back and enjoy. Lymphedema is swelling that happens when something affects your lymphatic system. Lymphedema often affects your arms and legs, but it may also affect any other part of your body. Healthcare providers can't cure lymphedema. This is very important. Healthcare providers cannot cure lymphedema. So if you have lymphedema and you're going to a healthcare provider, they're telling you, we don't know how to fix this. There's no cure for this. This is a picture, a real life picture of lymphedema. A very horrendous swelling of lymphedema, but nonetheless an actual photo. Further in this article from Cleveland Clinic, your lymphatic system collects excessive fluid, proteins, and toxins from your cells and tissues and returns them to your bloodstream, where then the liver, spleen, kidneys can actually filter them out. What are some of the most common parts of your lymph system that you would be familiar with at home? Your tonsils are lymph nodes, first defense against infections that we swallow in our food or water. And of course, if you have those removed, now you're susceptible to everything else. So your health does not improve by removing your tonsils. You just removed the very first defense of your immune system to actually sample everything you swallow. Is what the tonsils do. They literally take samples of everything you swallow and then signal to your bone marrow, your spleen, and your thymus gland what was detected in your food or in your water and what cells to start producing, called white blood cells, in the form of B cells, T cells, macrophages, phagocytes, to go eat the bacteria, fungus, parasites, or toxins that you just swallowed. So what do you think happens to people when you remove their tonsils? Do you think their defenses against all future infections goes up, or do the defenses go down? No, your immune system forevermore is challenged when you remove your tonsils. And I know before you had your tonsils removed, it hurt to swallow. But if your healthcare provider would have helped you figure out why they were swollen in the first place, instead of ripping them out, you would still have a very healthy lymphatic system. When your lymph system doesn't work well, Cleveland Clinic says, your body accumulates fluid and may begin to swell. Lymphedema also increases your risk of developing an infection where you have the condition. If you've got blocked lymph vessels, which picture your blood vessels throughout your body, you actually have just as many lymphatic vessels carrying lymph fluid, and that helps remove infections and toxins. All of you have had swollen lymph nodes in your groin, armpit, even in your breast at some point, or in your throat, or in your collarbones, along your neck muscles. Now, you've got thousands of lymph nodes. Their job is to remove infections. If you have swelling in a lymph node, the lymph ain't moving. It's dammed up like a river. Now you've got a lake pooling of infections, and the likelihood of developing infection goes up with lymphedema. Lymphedema symptoms may be mild, causing your minor swelling and discomfort. However, lymphedema may cause significant swelling that can be painful and cause skin tissues or issues such as infections and wounds. Healthcare providers cannot, they repeat, cure lymphedema. So if you think you're going there for them to heal you, they're not. But they do have treatments to reduce swelling and discomfort, which is true, and we are going to cover that here. Is lymphedema a serious medical condition? Cleveland Clinic asks. It can be. If you have lymphedema, you may be at risk of developing infections that start in your skin. Yeah, I'm going to show you pictures in a little bit. These infections may be life-threatening. Well, that's not good. Rarely, lymphedema may also lead to lymphangiosarcoma, a very rare skin cancer. Now, there's two types of lymphedema. They're called primary and secondary. We're going to dive into primary here first, and we're just going to give you the highlights. They write it out pretty well in layman's terms here on the clevelandclinic.org. Primary lymphedema comes from rare inherited conditions that affect how your lymphatic system develops. Primary lymphedema affects about 1 in 100,000 people in the United States. Now, with the definition primary, or the category primary lymphedema, you would think primary means that's the number one type of lymphedema. It is not. By far, secondary lymphedema is more common. So they're just telling you primary lymphedema by definition means you inherited an issue with your lymphatic system. And they define what these types are. There's several kinds of primary lymphedemas, which are more rare. Infancy. Infants may be born with Milroy's disease, an inherited form of lymphedema. Puberty during pregnancy or up until age 35. There's a condition called Meigs disease, lymphedema praecox, may affect people going through puberty or pregnancy and up until age 35. After age 35 is the third category of primary lymphedema. A rare late onset lymphedema can cause lymphedema with swelling limited to your legs. Well, what is secondary lymphedema, which is primarily what you're all going to be confronted with or have seen in your family? Secondary lymphedema may happen if your lymphatic system is damaged from surgery, trauma, or radiation therapy. It is most common in people who have had breast cancer treatment. That said, not everyone who has had breast cancer treatment develops lymphedema. So just because you had breast cancer treatment doesn't mean you're going to develop lymphedema, but it is the most common. So lymphedema primary, you just learned it's genetic, but that's a rarer type of lymphedema. The most common is the secondary lymphedema, most commonly caused by medical doctors treating your breast cancer. So let's find out more about lymphedema. In case you're curious, if you have lymphedema and you don't know and you haven't been diagnosed yet, here are some of the most common symptoms for lymphedema per the Cleveland Clinic. The most common is swelling. Swelling may develop slowly. You may not notice unusual swelling in lymphedema's early stages. Swelling from lymphedema may also come on suddenly. Here are some of the most common symptoms, and they say if you notice these, you might want to call somebody. You can't see or feel the veins or tendons in your hands and feet. Your arms or legs appear to be slightly different sizes. It feels as if your joints are unusually tighter and flexible. Your skin seems puffy or red, swelling in your arms or legs or other areas of your body. Your arms, legs, or other parts of your body feel uncomfortably heavy or full. Your clothes or jewelry may fit tighter than usual. You have a feeling of burning or itching. Your skin becomes noticeably thicker. These are common symptoms of lymphedema. What causes lymphedema? Well, I just highlighted for secondary lymphedema, the most common cause is breast cancer treatment. So you see there, that is the first one they highlight. Causes of lymphedema, breast cancer surgery. Sometimes breast cancer surgery includes removing lymph nodes under your arms and possibly damaging nearby lymph vessels. And then pelvic surgeries are number 2. Surgery to remove pelvic lymph nodes may cause lymphedema. And this can be common in prostate issues, by the way, like prostate surgeries. Radiation therapy may cause scarring and damage to your lymphatic system, inflaming your skin and placing pressure on your lymphatic circulatory system. Also, we referenced earlier trauma. Your lymphatic system is a rich network of vessels that are directly under your skin as well as deep. Sometimes trauma to an area of your body may damage those lymphatic vessels under your skin, causing lymphedema. Then you have infections that can cause lymphedema. An infection may increase lymphatic system damage. And then having obesity. When I'm going to show you some pictures here later in this presentation, pictures of lymphedema, complications of lymphedema, you are going to recognize that many of those individuals, either yourself who may be obese or those around you, or even out in public, you have all seen lymphedema in obese people, particularly when they're wearing shorts or skirts or dresses. You will see it in their calves. You'll see it in their feet. And I'll show you here. How do you get rid of lymphedema? Says the Cleveland Clinic. There's no cure for lymphedema, which means you can't get rid of it. That's pretty funny because Cleveland Clinic should watch this presentation because I'm going to show peer-reviewed published research studies of 2 minerals that have a significant impact on helping to improve and reverse lymphedema. It's going to be exciting. All right. However, your healthcare providers cannot cure it, which means you can't get rid of it. Cleveland Clinic. Are there surgical treatments for lymphedema? You better believe it. Lymphatic bypass procedures. This surgery involves connecting and rerouting lymphatic vessels and veins so they avoid obstructions and let lymph drain into your body's venous system. Lymph node transfer is the next procedure, surgical. Surgeons replace damaged lymph nodes with healthy lymph nodes taken from other areas in your body, essentially creating a new lymphatic system for the areas of your body affected by lymphedema. And I have not even looked into the efficacy of this type of procedure, but I guarantee you it's pathetic. Like this really working really well. I can just imagine the scarring that's going to happen when you take a lymph node that has multiple vessels coming out of it and reattaching that somewhere else, that the scarring is going to not impede the flow of lymph there. I guarantee you that's not very effective. The bypass procedures are debulking. This surgery treats very severe forms of lymphedema. It involves surgically removing all of your skin, fat, and tissue in the affected areas of your body, and then placing a skin graft over this area. So just beware. I'm about to show a picture here in a second. And if you want to just close your eyes for a second, maybe you don't want to see it. But I'm going to show you in just a minute. I will warn you when it's coming up. All right. So this slide reads, ask your doctor if these side effects are right for you from the procedures they just described for lymphedema. The first one was lymphovenous bypass surgery for breast cancer treatment. So let's dive into that. These are things you should expect. These aren't the gross images yet. What to expect after lymphovenous bypass surgery for breast cancer treatment. These are the complications, everybody. Remember, this is the most common cause of lymphedema in America. After lymphovenous bypass surgery, the patient can expect this, a recovery process coordinated with a breast surgery care plan, which will include a short hospital stay, most likely, periodic follow-up appointments with a multidisciplinary team, including therapy specialists to monitor lymphatic function and limb conditions. Is the arms moving? Can the shoulder raise? Is there swelling coming up in the breast area, under the arm, and in the arm? Standard lymphedema management practices such as compression garments, manual, using your hands to massage the lymphatic drainage, and physical therapy as part of a coordinated post-operation care plan. Continued surveillance using lymphedema indexes called LDEX measurements and clinical assessments to detect any early changes in lymph flow, because it's coming. What are the risks and potential complications of bypass surgery called lymphovenous bypass surgery for breast cancer? Treatment. Like any surgery, lymphovenous bypass carries risk of potential complications, including infections, delayed wound healing, and surgical failure. In some cases, the lymphatic reconnections may not fully restore fluid drainage. Yeah, I bet. Here is in the Annals of Vascular Surgery medical journal from 2022. This is a multi-analysis of 37 studies on the effectiveness of microsurgical techniques for lymphedema. So these are surgeries for lymphedema. We performed a multi-analysis of the effectiveness of lymphatic microsurgery. We searched the databases of literature for articles in Chinese and English. They say lymphography showed that lymphatic transport capacity was enhanced. When they did the graph, more lymph was moving. Moreover, 12% of patients reported that edema reappeared, though, in the long term. 26% required reoperation because of unsatisfactory results. That means almost 1 in 4. And 32% experienced lymphatic leakage. So lymph was coming out of the lymph system because they never reattached. So where they took the two ends of the blood vessels and tried to graft them together in your lymph system for this procedure, the lymph just was leaking out. It never actually healed. So when I said earlier, I doubt that really works. When they reattach a lymph node and put it in another part of the body, I guarantee it's deplorable results. Here you're seeing that when they did graft them together, 1 in 3, that graft didn't work, and the lymph was just pouring out into your body, which is going to create an environment of sepsis and worse disease. But I just want you to see those. If any of you are considering this type of this bypass or grafting for lymphedema, just know 12%, 1 in 10 reported increased edema reappearing in the long term. 1 in 5 required reoperation. Just know this is what's coming. The likelihood most people are going to have this operation redone. 1 in 4 fail. and have unsatisfactory results. They have to do it again. 1 in 3, the graft didn't work anyway, and they're just leaking lymph into the body, which is not good. This is breastcancer.org, lymph node removal, recovery, and side effects, which I mentioned earlier is probably pathetic results. This is in the part of the article titled Recovery from Lymph Node Removal. And you're all very familiar with this. Breast cancer, they'll have lymph nodes in the breast removed and then very often into the armpit. Your recovery time from lymph node removal will vary based on the number of lymph nodes removed during surgery. If you had any axillary is your armpit. If you had any armpit lymph node dissection, there will be a small tube called a drain coming out of your underarm area after surgery. The drain pulls excess fluid from the region where lymph nodes were taken. This fluid flows out of the body and into a container. As part of your recovery, you'll need to monitor and empty your drain. Other post-surgery instructions include these. You need to take your over-the-counter or prescription pain meds as your surgeon prescribes. Wear a supportive bra. I don't like that idea, actually. Showering once your surgeon says it's okay. I like showering. Beginning gentle arm exercises to relieve tightness and restore range of motion. You better start doing that. And then checking with your surgeon to see when you can resume heavy exercise, such as running and lifting weights. I like that recommendation also. Short-term side effects of the lymph node removal. Sentinel lymph node biopsy. This is the first procedure they're going to talk about with lymph node removal. You may feel some of these short-term side effects, including soreness and tenderness under your arm, numbness and tingling that lasts from 1 week to several months. So if you've had this done, you're wondering why it ain't going away. My arms are still tingling, legs still tingling. There's a reason. Hardening scar tissue along the incision. A buildup of fluid under the arm called seroma. Stiffness in the arm and shoulder that limits your movement. Of course you do. You're going to have swelling after a procedure of any kind. If your surgeon used blue dye to map your lymph nodes for surgery, the color will fade with time. Still, your skin might have a faint stain for up to 1 year after surgery. You might be blue for 1 year on your arm. And urine and stools may also look bluish green for 1 to 2 days after surgery. Now, in your armpit, removing lymph nodes in your armpit, called an axillary lymph node dissection. Many of the short-term side effects of removing lymph nodes in your armpit are the same as those you might have after a sentinel lymph node biopsy. Watch out for and alert your doctor if you have any of these: fluid buildup or signs of infection. So if you develop lymphedema and infection, call your doctor right away. Inflammation in the armpit region, which is lymphedema. A swollen arm, which may be a sign of a blood clot or lymphedema. Make sure you call them right away. Long-term side effects of lymph node removal includes, look at this, lymphedema, which we've already shown you what it means. It's swelling. Buildup of lymph fluid can develop in your arm and any other part of your body. Lost or decreased sensation in the back of the arm or armpit. Sometimes the nerve supplying sensation to the back of the arm and armpit is cut, stretched, or damaged during surgery. This loss of feeling may be temporary, but for some people, it may persist forever. So just know, anytime you go under the knife, there's an area underneath the arm by the armpit, behind the arm, where they will cut in there, and they often cut a nerve, and you will have either no sensations, tingling, or pain, or nothing for the rest of your life, possibly. Tingling, numbness, stiffness, weakness. It's important to let your arm become weak, not to let your arm become weak and stiff as a result of armpit discomfort and limited range of motion. Fight through the pain after your surgery. Physical therapy and exercise can help restore your arm movement and strength. And that's very important. A winged scapula after your surgery. If these nerves are cut, removing lymph nodes in your armpit. Some people, when they reach their arm forward, their scapula, your shoulder blade, will actually wing out like a wing on a bird. And this is called a winged scapula. They say this is a rare complication, as you see there, but they say causing your shoulder blade to stick out when you hold your arm out straight. Lymphadenectomy, removing lymph nodes, lymph vessels. Here we go. Some side effects may start right away. Pain at the surgery site. Pain at the surgery site. Sorry for that one. Which is normal for the first few days. Numbness or tingling caused by swelling, which squeezes the nerves. Wound infection that causes redness, pain, and sometimes discharge. Clots, which may happen if blood pools in your blood vessels. Some side effects are associated with the lymph node location. So, such as your underarm axillary lymph node dissections, is associated with a higher chance of developing lymphedema, decreased movement of the shoulder and arm, axillary web syndrome, AWS, which is the same acronym for Amazon Web Services. That's not what we're talking about here. We're talking about armpit web syndrome, which involves scarring in the connective tissue, forming a rope-like structure that starts in the armpit and may extend all the way to your elbow. It will feel like there is a tight cord attaching your shoulder and your armpit down to your elbow, causing pain and restricted movement, and may go away on its own or require therapy, physical therapy. Now, this I don't like. Neck dissection side effects usually involve nerve damage. So removing lymph nodes in your neck usually cause nerve damage, causing numbness to the ear, weakness in the arm, or weakness in the lower lip. These effects may be temporary if the nerve is damaged and just needs to heal, although it may take months. If the nerve was removed, the change is usually permanent. Then we get to retroperitoneal lymph node dissection. This is common with prostate. This is down in your pelvic area. Does not affect sexual function in men, but sometimes one of the nerves responsible for ejaculation may be injured. This may cause retrograde ejaculation, meaning that the semen goes backwards, doesn't come out of the penis, goes backwards into the bladder. Instead, this may make it more difficult to father children, they say. These are complications of these removal of lymph nodes and lymphatic vessels. Some side effects may be a sign of something serious happening and should not be ignored. So if you've had any of these lymph nodes removed and you start having these symptoms, these are not to be ignored. Pain at the wound site is getting worse instead of better, or not improving with pain meds even. Fever or chills, breathing difficulties such as shortness of breath or having trouble taking a breath, bleeding at the wound site or anywhere else, difficulty urinating, painful urination or bloody, cloudy, or foul-smelling urine, unusual pain in the legs, chest, or belly, a severe headache, any other symptoms the healthcare team mentioned. Now, this is where it's going to get gross in a second, so just stay with me. I'm not going to show you gross yet. Here we go. When it comes to lymphedema, when it becomes really severe, they will do skin graft surgeries. They will remove the whole skin of your leg, fat tissue, like I read earlier. And then they will do skin grafting as a fix for lymphedema. Skin grafting is a type of surgery. Providers take healthy skin from one part of your body and transplant or move it. This is most often I think of during burn victims, right? Grease fires, it doesn't matter. They will graft areas of other parts of the body to replace the scarred, melted parts of your skin that were damaged by fire and heat. But this also happens in lymphedema. The healthy skin covers or replaces skin that is damaged or missing. A skin graft after surgery to remove skin cancer is an example. And in lymphedema. All right, everybody, turn your heads if you get queasy. If you're, some people like horror films, gross images. If you're a little bit more on the sadistic side, you might want to watch this. All right, so check it out. This is an image on the left, far left, of the individual with, you can see, discoloration and massive lymphedema. The picture immediately adjacent to it is when they removed all the skin and fat and lymph nodes and vessels from all the muscles of their leg. So all you're seeing there is muscles, bone, ligament of the whole lower left leg. Then you're going to see they're going to let some of the muscles heal, and then they start grafting skin from other parts of the body, cutting skin from other parts of the body, literally with like a potato peeler on other parts of your body. They literally peel away the top layers of your skin and then go place them on the parts of the leg they just removed all of the lymphedema at. This is grotesque. I've never had this done before. This is the first visual I've ever seen, and thought you wanted to see. This is what they do. This might make you want the supplements I'm going to show you later that have been proven to help improve lymphedema. So what are the risks of complications of skin graft surgery for lymphedema and cancer and burns? Sometimes this transplanted skin doesn't take to the new area. If the transplanted skin doesn't take, you may need another skin graft. An unsuccessful skin graft usually results from blood or pus pooling underneath the transplanted skin, or an infection, which is a complication of lymphedema anyway, injury. Okay, so if you have lymphedema and you have an infection under there, what do you think is the likelihood that when they cut off all that person's leg, all their skin, fat, and lymph nodes, what do you think is the probability they got 100% of all of the little bacteria, virus, fungus that were underneath that lymphedema inside the skin of that body and lymphatics of that body when they cut all that off the leg? It was all purple. You saw it, which is a pretty tall tale sign of an infection underneath the lymphatics. Injury or damage to the graft site, such as moving the newly transplanted skin too much while it's healing, and stretch it too far. Problems with blood circulation that cause the wound to heal too slowly. I think you can all imagine there's a lot of complications to skin grafts. Other complications include bleeding, contracture, discolored, patchy, or uneven skin, loss of skin sensation because you cut all the nerves that were originally there that go all the way to the surface of your skin, pain that lasts after the area has healed, scar tissue building up around the graft site. Now let's dive into just a few things I, Dr. Brian Ardis, recommend for lymphedema based on peer-reviewed published medical journals reviewing minerals, vitamins, and their impact on the lymph system. And some of them specifically are highlighted here for lymphedema. All right, this comes from Nutrient Journal, a very reputable nutritional medical journal from 2020. Selenium deficiency, which is a mineral, which you've heard me talk about forever. Selenium deficiency in lymphedema and lipedema, swelling of the fat cells of your body. This study aimed to determine the prevalence of selenium deficiency in patients with lymphedema, lipedema, or lipolymphedema, and a possible influence of obesity as an associated medical condition leading to selenium deficiency, or vice versa. The selenium levels in this trial were comparable to the whole blood selenium values determined by Muck and his team in German patients, referencing a previous study done on lymphedema and selenium. Overall, our results showed that selenium deficiency is commonly associated with these medical conditions in a country with low selenium intake, like America. Obesity was an additional risk factor for selenium deficiency in lymphedema. In secondary lymphedema, which is the most common caused by surgery for breast cancer, secondary lymphedema, only in secondary lymphedema did selenium levels decrease with increasing BMI, while selenium levels in primary lymphedema, those rare inherited forms of lymphedema, were strongly reduced at BMIs greater than 30. If they had a higher BMI of over than 30, their selenium levels were lower. When it came to secondary lymphedema, which comes from trauma surgeries that we do to people, they saw a decrease in selenium for sure. Selenium levels decreased and the risk for selenium deficiency increased with increasing lymphedema stages. As lymphedema stages, as it gets worse and worse and worse and worse and worse and worse, where you're close to needing surgery, selenium's going down, 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 as it's getting worse, worse, worse. So if you're at lymphedema stage 1, selenium is low. You go to lymphedema stage 2, selenium's getting even lower. So there's a direct inverse correlation to the amount of selenium and the worsening of lymphedema, possibly due to increased oxidative stress, they say. Progression in lymphedema manifests as fibrosis, pulmonary fibrosis, you name it, cystic fibrosis, which is also closely connected to oxidative stress. A team of researchers led by a guy with a last name or girl, last name Seams, and their team showed that oxidative stress is increased in lymphedema. Stay with me. Oxidative stress is increased in lymphedema. In summary, selenium deficiency appears to be common in German lymphedema patients. There are some trials that investigated the effect of inorganic selenium form, sodium or salt selenite, in cancer-related lymphedema. In these trials, the combination of high-dose selenium and standard treatment significantly improved lymphedema compared to standard treatment alone. I find this amazing because the Cleveland Clinic told you there's no cure for lymphedema. We don't have anything we can tell you besides the surgeries. No, it's already been done in other countries. You got to go outside of America because I think Big Pharma just wants to suppress all these great, wonderful miracles of nature. Selenium's found in the dirt. It gets drawn up in your plants and you eat them. But we're all very deficient in selenium. Another researcher and his team named Han treated selenium replete, those that are low in selenium, lymphedema patients only, and showed a positive effect of selenium in the form they use called sodium selenite, which is selenium tied to sodium, salt. Additionally, salt selenite was used in many intensive care trials to correct selenium deficiency. So even if somebody's low in selenium, if they gave them this form of selenium, their selenium went up, which is protective here against worsening effects of lymphedema. Now we're going to stay right here. I know we're going to get into some scientific stuff. And if you check out, I'm going to try to do slow enough. That's okay. If this is too hard to follow, it's okay. Download the PowerPoint and go along slowly. We're talking about selenium and lymphedema. Th2, a form of white blood cell, a part of your immune system. Th2 helper cells are required for the development of lymphedema. And Th2 cytokines, interleukin 4 and interleukin 13, are anti-lymphangiogenic. Okay, follow with me. Th2 helper cells are required to create lymphedema, and these other cells you just learned about reverse it, adding to the disease process of lymphedema. Selenium deficiency favors Th2 differentiation. And up above, Th2 helper cells are required for the development of lymphedema. Selenium deficiency creates more Th2 helper cells. Therefore, selenium deficiency might increase the potential for lymphedema as an additional risk factor. Are you taking selenium every day? I do. Do you? I've been telling you to for 6 years. I hope you are. TGF beta, tumor growth factor beta, is significantly increased in lymphedema patients and plays an essential role in the development of fibrosis, a hallmark of lymphedema worsening. Selenium deficiency causes thyroid fibrosis, period. So if you don't want to get fibrosis and you have lymphedema, you might want to start supplementing selenium. A team of researchers led by Oglio showed that tumor growth factor beta disrupted the redox balance, the balance of oxidative stress in thyroid cells, and increased reactive oxygen species, ROS, increasing inflammation. Selenium might partially reverse the effect of tumor growth factor. Thus, selenium deficiency appears to play a role in lymphedema progression. They tell you, Cleveland Clinic, there's no cure for lymphedema. However, even if there is no cure, I'm showing you if you don't have selenium in your body at adequate levels, it leads to worsening progression of lymphedema. And I'm just going to say here, selenium is what your white blood cells need in the bone marrow to even be made. Selenium is required by your thyroid to produce T3, T4 hormone. Selenium is required by your liver to make glutathione, which protects you from cancer and lymphedema more than anything else. And you can't make glutathione without selenium. Your thymus gland, in order to function normally, to differentiate T cells, B cells, that are your immune cells to fight cancer and prevent lymphedema. The thymus gland needs selenium. So for protecting your immune system, improving your immune system's function and defense against lymphedema and infections of any kind, including cancer, you need selenium. Selenium was also proven by the University of Georgia in the 1990s to prevent anybody with HIV if they supplemented the dose in our selenium capsules. If you did that every day for 20 years with HIV-positive patients, not a single person developed AIDS over a 20-year period. In countries with selenium intake below recommendations, selenium deficiency is common in secondary lymphedema, which is caused by surgeries and trauma. So if you're having lymphedema or you are getting breast cancer treatment and it is the number one cause of future lymphedema, you might want to start supplementing selenium regardless. The risk for low selenium values increases in lymphedema patients if they are also obese. Obesity is also a complication for lymphedema. So is selenium deficiency. A low selenium status could have a negative effect on secondary lymphedema, and lymphedema, fat and lymphedema, as selenium deficiency is associated with an impaired immune function, like I just explained. This is another research study in the Journal of Trace Elements, elements being trace minerals like selenium, magnesium, zinc, copper, you name it. Journal of Trace Elements in Medicine and Biology. This is from 2016. Salt, selenium, and cancer-related lymphedema, biological and drug-like effects. A 5-year population-based study evaluated the incidence, degree, time, course, treatment, and symptoms of lymphedema in breast cancer patients after tumor resection. So after breast cancer surgery. The 5-year cumulative incidence of lymphedema was 42%, 42 for every 100 women. Incidence was higher for women that were younger than 50 years old. 50% of the women who got lymphedema after the surgery were those younger than 50. In the first 3 years, 23%, 1 in 4, reported no more than mild lymphedema. That's great. That means 75%, 3 out of 4 must have. 12% reported moderate or severe lymphedema. 2% reported a chronically moderate or severe form. 47% of the women with lymphedema received at least one type of treatment. Women with moderate or severe lymphedema were more likely to be treated, 68%. The study showed that patients with severe lymphedema were significantly more often affected by reduced selenium levels. Those results strongly indicate an increased selenium requirement in these patients. The researchers are saying the people with the most severe lymphedema after breast cancer surgery, they absolutely need selenium more than anybody else. They have an increased selenium requirement. Is your surgeon or oncologist recommending selenium to you? I bet they're not. The cause for increased selenium requirement could be enhanced oxidative stress and an elevated inflammatory activity, is what they're surmising. Symes and his team determined that in the tissues of chronic lymphedema, the formation of reactive oxygen species, ROS, was enhanced, and lipid peroxidation processes were accelerated. All increasing inflammation was accelerated. In the section of this research paper titled Salt Selenium Treatment for Secondary Lymphedema, the most common cause of lymphedema, several trials with oral selenium treatment showed that selenium lowers ROS production, inflammatory reaction. It causes a spontaneous reduction in lymphedema volume. When your legs swell, arms swell, ankles swell. They're telling you that oral selenium treatment causes a spontaneous reduction in lymphedema volume. The amount of lymph fluid goes down. Why isn't everybody recommending selenium? And selenium increases the efficacy of physical therapy for lymphedema. If you know a physical therapist who works on lymphedema, who does lymphatic drainage and modalities, they should be telling all of their clients to get on selenium. And it reduces the incidence of erysipelas. I hope that's how it's pronounced, but I'm going to show you what that is. Erysipelas, which are infections in patients with chronic lymphedema. I'm going to show you a whole bunch of pictures, a whole collage here in a second I just made in creating this presentation of erysipelas. It's a fancy word you don't know, but you've seen a million times in people in public or in your family. Selenium helps prevent that. Casaroller and his team evaluated the effect of oral salt selenium in combination with combined physical therapy, decongestant therapy in 179 lymphedema patients. In the first week, daily selenium treatment was 1,000 micrograms of selenium. That is 5 of our selenium capsules a day at the Dr. Ardis Show. In the second and third week, 300 micrograms of selenium, which is 1.5 of our capsules per day, were supplemented. Follow-up period was for 3 months. So the first week was 5 of our selenium capsules, for example. And then in the second and third week, they got 300 micrograms of selenium, which is 1.5 of our selenium capsules. Follow-up period was 3 months. During this period, patients received 100 micrograms of selenium per day, which is half of one of our capsules. The lymphedema volume was significantly more reduced in the intervention group. Intervention group is those that got selenium compared to combined physical decongestant therapy alone. Are you a physical therapist? Are you getting lymphedema treatment by anybody? If they're not telling you about selenium, you need to teach them about selenium. Because to reduce the volume of swelling called lymphedema, selenium is proven to significantly, I quote, significantly reduce more lymphedema compared to just physical therapy alone. Isn't that exciting? As if there's nothing to do for lymphedema. Sure there is, there's plenty. And notice on the Cleveland Clinic, they didn't say anything about selenium for lymphedema. Cleveland Clinic needs to get up to speed on research published in medical research journals around the world about the benefits of selenium so far, and what else I'm about to show you. Also, the skin fold index, folding of your skin, and mobility were significantly more improved with the selenium treatment group. Remember the restriction in movement, the loss of volume of weight? In the selenium supplemented group, the erysipelas incidence was 0% compared with 50% in those that just had intervention with physical therapy, someone massaging their lymphatic legs. Okay, we're going to highlight this. I'll put a red arrow there for you. This is what we're about to focus on. Erysipelas. In the selenium treatment group, compared to the selenium with decongestion therapy, manual massaging of lymph fluid in the body that is ballooning your legs and arms, they found erysipelas incidence was 0% in the selenium group, who got 5 of our selenium capsules for the first week, and then 2 of our selenium capsules for the second and third week, and then 1 capsule of our selenium for the remainder of the time. 3 months. All right, so what is erysipelas? Just want to remind you, those that took selenium at the same time for lymphedema had 0% of this problem I'm about to show you versus 50% in those who were getting physical therapy for lymphedema and were not taking selenium. So this is one of the most common complications with lymphedema surgery, okay, and trauma is infections. The type of infections you get from lymphedema is called erysipelas, the word you see there. Selenium supplemented for 3 months led to 0 lymphedema people develop this problem called erysipelas. What does it look like? It looks like this. You've all seen it. This is an infection under the skin. You'll see an example on the face of this lady on the left of the screen. And on the right, another woman on the left side of her face. And then you're going to see the legs. Remember, you've seen this in obese and diabetic patients. Lymphedema with complications of infections. You'll see this red, purplish coloring of their skin. Those getting lymphedema treatment by a physical therapist, manually massaging lymph accumulation, when they just took selenium, supplemented orally for 3 months, 0% ever developed any of these infections, compared to 50% who didn't take selenium. So of the millions of people in America and around the world getting lymphedema surgeries and surgeries that lead to lymphedema, infections are one of the most common side effects from these procedures. And you can prevent all of those infections simply taking selenium for 3 months. And I just showed you the doses. I don't know about you. Do you want infections? Do you want to have these cosmetic changes on your skin too? No. So take selenium, and then you won't have any of this. Read the statement. In the selenium supplemented group, erysipelas incidence was 0% compared to 50% in those who didn't take selenium. So half of everybody is getting these infections that look like this, and those that take selenium, none of them get it. Well, I don't know how to make this more powerfully exciting, but it makes me super excited to show you. All right, another research team led by Mikey determined the effect of oral selenium in radiation-associated secondary lymphedema. Remember, secondary lymphedema is from surgeries, procedures for cancers, and radiation is one of those. Radiation causes lymphedema, and that form of lymphedema is called secondary lymphedema. In this exploratory study, 48 patients were treated with 500 micrograms of selenium. That is 3 of our selenium capsules that the doctor already showed per day for 4 to 6 weeks. So just a month and a half. 12 patients displayed lymphedema of the arm, and 36 patients had lymphedema of the head and neck region after getting radiation. More than three-quarters of the patients showed an improvement of one stage or more according to the Foldy and Miller score. 65% of patients with interstitial grade 3 or 4 endolaryngeal lymphedema displayed a substantial reduction in the swelling of their neck, called endolaryngeal swelling. 65%. Three-fourths of the patients, 75%, saw an improvement of one stage or more of the lymphedema after having radiation for cancer. Nothing to do for lymphedema. Look at this. A big time complication of the swelling of lymphedema after these procedures: radiation, surgery, radiation treatment. Many of them require a tracheotomy because of the swelling is choking on their trachea. Therefore, I quote, no tracheotomy was necessary in any of these patients. But this is a common side effect in people with endolaryngeal swelling from lymphedema after radiation on your head and neck for cancer. Well, there's your selenium stuff, and I love it. All right, now we're going to dive into something that's the second ingredient in our biodefense product. You've heard me harp on this for a couple of years now. Nigella sativa oil inhibits proliferation and stimulates apoptosis of human lymphocytes. Lymphocytes are the white blood cells inside your lymph. So the volume of these are growing as you're having lymphedema. I'm just going to show you this title. Then I'm going to show you another title of a study, just to show you that they've been studying black cumin seed oil's effect on the amount and volume of human lymphocytes. The second research study is titled The Effect of Dietary Supplementation with Black Seed Oil, called Nigella sativa, and it mediates immune system function in male rats. Now I'm going to show you what they're talking about. What are they studying here? Since both allergies and autoimmune diseases and lymphedema are related to lymphocytes' abnormal activity in response to allergens or autoantigens, or in secondary lymphedema, surgeries, traumas, radiation, this study's purpose was to examine whether Nigella sativa oil, black cumin seed oil, could influence lymphocytes' ability to proliferate or their susceptibility to death, reducing the amount of lymphocytes, which would reduce lymphedema. Therefore, human lymphocytes were stimulated they stimulated how many lymphocytes they could create by giving them monoclonal antibodies and different solutions or amounts of black seed oil. So they could stimulate lymphocyte production by giving monoclonal antibodies, making more white blood cells. That's what antibodies do, right? Produce an immune response. Then they want to see what happens when we give black cumin seed oil. Our results indicate that Nigella sativa oil poses a powerful immune suppressive influence in the lab. The inadequate proliferative response and increased apoptosis of lymphocytes, the death of these additional lymphocytes, in the presence of black seed oil could reduce the symptoms associated with either allergies, which is inflammatory, or autoimmune diseases, which is inflammatory, and throw in lymphedema, which is inflammatory. Conclusion: the preliminary studies showed that black seed oil has a potent anti-proliferative, stops the growth of lymphocytes, and pro-apoptic effect on human lymphocyte in vitro. Biodefense. Ask your doctor if you have lymphedema, if black cumin seed oil and our biodefense is right for you. It reduces, black cumin seed oil does, the number of cell divisions and the percentage of proliferating cells, how many volumes of cells your body's making. These changes are accompanied by an increase in the percentage of dying cells, called self-dying cells, apoptotic cells. Since black seed oil is rich in many components, at least a few of which may have effect on lymphocytes. Now let's show you, we've showed you selenium and its impact on the number and volume of lymphocytes, which would also play a role in lymphedema and other inflammatory conditions like allergies you just read. All right, quercetin. I love this product. Quercetin is a flavonoid found in the rich colors of citrus fruits and vegetables. Quercetin has a novel therapeutic approach for lymphoma, another problem with the lymph system. Section 5.2 of this research study, titled Quercetin and T-cell lymphoma, a particular type of lymphoma. T-cell lymphomas are a group of diseases characterized by clonal expansion. Cloning, expansion, cloning, you know what cloning is, right? So replication of identical bad cells and dysfunction of T cells. T cells are thymus cells. T stands for thymus. And these cells, you'll see, are classified in two types: T cell lymphomas. T cells, thymus cells, are differentiated, changed by your thymus gland. Differentiated means changed, and categorized to defend against certain things already in the body: bacteria, infections of viruses, fungus, parasites, and cancer cells. The thymus gland tells white blood cells made by your white blood cell what type of white blood cell they're going to be. They're either going to kill cancer, kill infections. That's its job. T cell lymphomas are bad because they affect your T cell production, which are protective for all diseases and infections. T cell lymphomas have been classified into two groups you're learning here: cutaneous, TCL, that's your skin is cutaneous, and peripheral, which is your arms and legs, outside of the skin and outside of your vital organs. The PI3K AK2 pathway, don't try to remember that, but just remember the P13K AK2 pathway is the main target in anti-malignant therapy. If you have malignancy, the main target is the P13 or PI3. I think it's PI3. PI3K AKT pathway. So just know when you have cancer, this pathway is what they're targeting if it's metastatic. All right. As a lipid, fat kinase plays a key role in malignancy cell transformation. PI3K is involved in regulating cell growth, survival, apoptosis, cell death, and angiogenesis, the worsening of cancer. A researcher named Maury and his team indicated that in human leukemia cell lines, quercetin can inhibit the upregulation of ART1-2 and tensin homolog P10 pathways by reducing what you read above, PI3K AKT pathways, which is the target of drugs for malignancy tumors, and suppressing the proliferation in human leukemia cell lines. That's what quercetin does. Quercetin attenuates, stops the PI3K AKT pathway and prevents survival signals in lymphoma growth. So I had to share that PI3/AKT pathway above because that is what is targeted by drugs treating malignant tumors. If the PI3K/AKT pathway is allowed to continue, it increases the metastasis and growth of a tumor. So the drugs they're giving you are targeting that pathway to stop the growth rate of tumors. Well, you're learning here that quercetin blocks also and targets the PI3K pathway and prevents survival signals in lymphoma growth. Well, how many people with lymphoma are being told that quercetin has the exact same benefit without the toxic effects of the drugs they're giving you to target the same pathway for the growth of tumors that are metastasis? Ask your oncologist if quercetin is right for you, or if more lymphoma cells are right for you. Now, in section 5.3, they're going to go to a different type of lymphoma called large B lymphomas, known as Hodgkin's and non-Hodgkin's lymphoma. Quercetin and large B lymphomas. Another type of lymphoma is the B-cell lymphoma. Aggressive lymphomas require serious treatment. Slow-growing lymphomas can be treated with radiation therapy, but the aggressive type has to be treated with chemotherapy in addition to radiation therapy. Chemotherapy and radiation therapy have many adverse effects. Continuing in this section, researcher named Lee and his team studied the U937 lymphoma cell line and found that the main mechanism of inhibiting lymphoma cell growth is related to cell cycle arrest in what is called the G2M phase. They found that quercetin stabilized U937 cells in the G2M phase. So, the mechanism of stopping lymphoma cell growth is related to arresting or stopping the G2M phase pathway. And quercetin does it. Okay, well, if these are the most serious lymphomas, the large B lymphomas, non-Hodgkin's and Hodgkin's lymphoma, how many of you know anybody who has survived non-Hodgkin's lymphoma or Hodgkin's lymphoma and were ever told that they should take quercetin? And if not, I'd like to know why not. Researchers found that consuming more flavonoids, such as quercetin, and the researcher they're referencing above is Frankenfield and his team, they found that consuming more flavonoids, such as quercetin, reduces the risk by 47% in the highest quarter compared to the lowest, and that the more flavonoids were consumed, the lower was the risk of non-Hodgkin's lymphoma. And they named some of those other types of flavonoids: epicatechins, anthocyanins, and proanthocyanidines. There you go. Those are bigger than Scrabble words. You only get 7 letters in Scrabble. Those are all bigger than that. A little bit harder for me to pronounce. But I quote, the more quercetin and these other flavonols you consume, the lower was the risk for non-Hodgkin's lymphoma. Is your oncologist teaching you that and telling you that? Is your primary care doctor teaching you that? Kabahara and his team studied lymphoma and leukemia cell lines, especially Dowdy, Burkitt's lymphoma, and found that cyclopamine and quercetin inhibited cell line growth and stimulated cell death of those lymphoma cells. Quercetin reduces the expression of Notch1 protein, which none of us know anything about, including me yet. Quercetin reduces the expression of Notch1 protein and its active component in T leukemia cell line formation. They concluded, these researchers, that these natural substances, quercetin, could be used as targeted treatment for chemotherapy-resistant lymphoma and leukemia. If your oncologist is shooting you with radiation and chemotherapy and it ain't working against your lymphoma or leukemia, quercetin is a natural substance that could be used. I mean, how many people have been treated for these types of lymphomas or leukemias and we're told there's nothing else we can do at St. Jude's Hospital, at Scottish Rites Hospital, at the Mayo Clinic, at wherever? I'm sorry, there's nothing else we can do. We tried chemotherapy and radiation and your lymphoma, leukemia didn't respond in your child or yourself. Oh, really? Did you try everything? Did you try quercetin? You might want to share these research studies with as many people as you can. Did you know that quercetin has an anti-malignancy effect? This is section 5.5 in this research study about quercetin's effect on lymphoma leukemias. Anti-malignant effect of quercetin. Quercetin has chemopreventative and chemotherapeutic effects. Holy cow, it acts like chemotherapy? In the body and in the lab, it's been used as an anti-tumor drug. How many of you knew that? How many oncologists are talking about quercetin as an anti-tumor drug? This natural product has antioxidant effects in small amounts and pro-oxidant effects in large amounts. Therefore, it can be used as a chemotherapy drug. Did you know quercetin can be used as a chemotherapy drug? By reducing malignant cell growth and proliferation. Proliferation means growth of, apoptosis and cell cycle arrest, etc. Ask your doctor if you have lymphoma, leukemia, lymphedema, if flavonoids, such as quercetin, are right for you. How many of you knew that quercetin is considered a chemotherapy drug without the side effects of chemotherapy? God made in nature his own chemotherapy drug called quercetin, found in the skin of your grapefruits. I thought that was exciting. One of the main roles of quercetin is to inhibit the growth and proliferation of many types of malignant cells, including lymphoma, prostate, cervix, lung, breast, and colon. Quercetin can cause cell cycle arrest in the G2M phase that we talked about earlier, depending on the type of cancer cells. Oxidative stress is caused by imbalance between oxidants, such as ROS, we've talked about in this current presentation, and antioxidants. Quercetin increases the activity of antioxidants like vitamin C by increasing the glutathione level in your body, the most powerful antioxidant in your whole body to prevent disease and cancer. Glutathione as a donor is involved in the conversion of hydrogen peroxide to water. All of your cells in your body, when any infections in your body or cancer, your cells start producing hydrogen peroxide. And if your body can't turn that volume of hydrogen peroxide back into water, hydrogen peroxide at very toxic levels will make you sick or even kill you. So, quercetin helps to take the extra oxygen off of H2O2, which is hydrogen peroxide, take the extra oxygen off to create water, which is H2O, by the enzyme superoxide dismutase. They tell you there. According to researcher Moriah, 300 micrometer or micromoles of quercetin inhibited the increase of reactive oxidative species, the cause of disease and infections and cancer. Quercetin possesses anti-tumor effects. Anybody with tumors, malignancies, are you on quercetin? And induces the anti-cancer effect against cancer cells via modulating various signal pathways involved in cancer development and progression. Quercetin could be helpful as a supplement in cancer prevention. What? This is a medical research study. Are you taking quercetin to prevent cancer? Is anybody telling you to besides me? And as a low toxicity therapeutic molecule for cancer treatment. If you're on any other cancer treatments, you should take quercetin too. It reduces the stress and inflammation and side effects. It seems that quercetin can strengthen the effects of other chemotherapeutic drugs. Everybody who's getting cancer treatment, prevention worries, you should be on quercetin, whether you're being treated or not. Now let's talk about vitamin C, one of my favorite things on the planet. We only got vitamin C and one more incredible nutrient to highlight here in a second. So we've talked about selenium, quercetin. Now we're going to dive into a third study. Researchers examine how ascorbic acid called vitamin C prevents oxidative damage using purified human T cells. They report similar effects. Medium to high concentrations of ascorbic acid decrease T cell proliferation. What? That's what lymphedema is. While at higher concentration, even higher than the first dose, ascorbic acid decreases cell viability and interleukin-2 secretion more than 90% to help prevent worsening effects of cancer and lymphedema. At even higher doses, the proliferation of lymphocytes was inhibited, and there was an increase in apoptosis when ascorbic acid was added before the activation. In a study on the effect of vitamin C deficiency on lymphocyte numbers in guinea pigs, which is a mammal like humans, the investigators found that in animals with a 4-week ascorbic acid-free, no vitamin C diet, the number of T lymphocytes decreased continuously, while T cell numbers slightly increase in ascorbic acid supplemented animals. Plasma and tissue concentrations of ascorbic acid, vitamin C, were significantly lower in animals without vitamin C compared to vitamin C treated animals. And I'm going to summarize this here in just a second. In another study using vitamin C deficient mice, the researchers determined the long-term effect of vitamin C deficiency on immune cells using a diet with an increased ascorbic acid level, vitamin C, of 200 milligrams per every 2.2 pounds of body weight. During this 1-year study, T lymphocytes in the peripheral blood increased in number. More specifically, the number of naive T cells, memory T cells in the spleen, and mature T cells in the thymus gland increased. And all of these help with these Th2 helper cells that lead to worsening lymphedema. Ask your doctor if vitamin C is right for you. Vitamin C supplementation in this 2024 study in the treatment of autoimmune and onco-cancer hematological diseases, from prophylaxis, preventative, to adjuvant therapy. If you're getting cancer treatment, what's the effect of having vitamin C with it? These results have explained over time with various hypotheses aimed at supporting the positive and protective role of vitamin C in patients with cancer. The protective effects of vitamin C has been traced back to its immune modulating action, its ability to promote collagen synthesis. Anybody out there with anti-wrinkle, anti-aging concerns? Vitamin C prevents that. And its inhibitory effects on enzymes involved in the mechanisms of metastasis or on potentially oncogenic viruses, cancer-causing viruses. Vitamin C helps prevent metastasis and helps kill viruses that lead to cancer. Furthermore, vitamin C can increase sensitivity to chemotherapy. So if you're on chemotherapy, it's not working. If you add vitamin C, oncologist, it works better and reduces the toxicity of cancer, the side effects of cancer treatment called chemotherapy, which there's a billion toxic effects of that. Vitamin C also contributes to iron metabolism, the values of which are altered in the cells of some tumors, breast cancer, prostate cancer, and lymphoma, due to an increased iron absorption process and reduced iron disposal. Vitamin C helps with all of that. High-dose vitamin C may elevate cellular labile iron pool concentrations, causing cell death through iron death called ferroptosis. iron in the cell, killing the cell, an iron-dependent type of controlled cell death. Moreover, vitamin C produces hydrogen peroxide in the extracellular space outside of your cells, consequently inhibiting tumor cells. Remember the book I taught all of you about called The 1 Minute Cure, all about using hydrogen peroxide at very small doses over a 21-day period to help prevent and treat and cure, and all the case studies in that book? Cancers of all forms and types, including prostate cancer. Vitamin C increases hydrogen peroxide in your body, like I just mentioned. And hydrogen peroxide is created in the body by your cells and through vitamin C supplementation to kill cancer cells, stop metastasis, and kill viruses, bacteria, and fungi. When it comes to the ways in which vitamin C might impede the growth of lymphoma cells, an impact on epigenetic processes appear to be a key factor. DNA methylation is a crucial method for regulating gene expression. And this is important. DNA methylation is important. How many of you have heard of the gene mutation called MTHFR gene? And you need, all of you know about methyl forms of B9, B12 called methylfolate, methylcobalamin. I need to explain something here. I do not highlight it in this PowerPoint. If you're dealing with any of these issues that are directly caused by DNA methylation, and it is required to help improve vitamin C's ability to prevent cancer. In our new Hydrate Complete formula, the last ingredient on the list is called betaine anhydrous. Betaine anhydrous provides methyl groups to everything you're consuming. So if you can't methylate in your liver, you should be drinking our Hydrate Complete 1 to 2 a day to get betaine anhydrous to help you with DNA methylation of anything you're eating. That's what it's for. And you lose betaine anhydrous in every drop of sweat, or for any causes of diarrhea, or if you're on high blood pressure medications or any medications that lead to dehydration, which is why it's in our Hydrate Complete. It is the only one in the world of hundreds of brands of hydration products that has betaine anhydrous in it. Now we're going to talk about zinc after vitamin C. So this journal of nutrition, this is from the year 2000. It's titled The Dynamic Link Between the Integrity of Your Immune System and Zinc Status. And it's highlighted here. The next step was to demonstrate that zinc deficiency, low amount of zinc in your human body, rapidly depletes B cell compartments of your bone marrow. Remember, your bone marrow makes all your white blood cells called T cell, B cells, macrophages, phagocytes, you name it, that kill cancer cells, prevent lymphedema, and all infections. They say recent work showed that zinc deficiency caused a 50 to 70% decline in B cells, with somewhat similar declines noted for immature B cells. Conversely, pro B cells exhibited no change in their distribution, gradually becoming a greater proportion of the marrow as the compartment was depleted of the precursors to create new immature B cells. So the development of B cells, new B cells by your bone marrow, goes down when you're zinc deficient. Evidence provided by other laboratories indicate that zinc deficiency causes cell death in embryos and enhances DNA strand breaks. You want to protect your DNA? You better have zinc in a zinc deficient infant rhesus monkeys. They figured that out. And that calorie restriction can also enhance cell death. We talk about intermittent fasting all the time, right? Apoptosis clearly plays a role in nutritional deficiencies that must be better understood. Well, let's see what they learned in this study. It is becoming evident that zinc deficiency has a substantial and rather specific impact on the lymphocytic branch of your immune system, the lymphatic system. The rapid depletion of the bone marrow and the thymus gland behind your sternum, the two most important parts of your immune system, for the precursor T and B cells. As zinc deficiency advances, it reduces the ability of the immune system to replenish the peripheral blood supply and the secondary immune tissues, lymph nodes, lymph vessels, with adequate numbers of lymphocytes. You can't even make enough of your white blood cells to protect you if you don't have zinc. A significant factor in the thymus atrophy, the T cell, T thymus, this atrophies over your lifetime. A significant factor in its reduction in size and lymphopenia, low levels of lymphocytes that accompany zinc deficiency, is an alteration in the production of lymphocytes and a loss of precursor cells to become B cells, T cells, macrophages, and phagocytes. An apoptic, a death mechanism because of zinc deficiency. Therefore, a reduced ability to replenish the lymphocyte population by the primary tissues of the immune system is a key player in the observed lymphopenia that reduces host defenses, your defenses immune-wise, against cancer and infections. The rapid and dramatic decline in the proportion of precursor T and B cells in the bone marrow and thymus gland is another clear example of the tight link of segments of the immune system to zinc status. This is why zinc was so important during COVID-19. Dr. Ben Marble, Dr. Zev Zelenko did a great job in March of 2020, making sure the whole world knew the importance of zinc. In our Dox viral defense, I'm going to highlight 5 nutrients that are in there that I just showed you had some major proven, scientifically backed, peer-reviewed impact against metastasizing cancer tumors, lymphedema included, leukemia also, and B cell lymphomas, the B large ones, non-Hodgkin's and Hodgkin's. All 5 of these nutrients I just talked about. There's only 5 ingredients in Dox viral defense: zinc, selenium, N-acetylcysteine, quercetin, and then betaine anhydrous. Now you may be thinking, he didn't talk about N-acetylcysteine. Oh, yes, I did. You just didn't see it. Selenium is required to make glutathione. Do you know selenium, when it goes inside your liver to make glutathione, the most powerful antioxidant your body can make? Did you know that N-acetylcysteine has to be combined with selenium to produce it? You just didn't see it. I didn't highlight it. Zinc, quercetin, N-acetylcysteine, selenium, and betaine anhydrous. Betaine anhydrous for the DNA methylation is why it's in there. Now, I would also encourage anybody with lymphedemas that they be taking what I recommended earlier. You should be supplementing the selenium doses they gave you. They said 5 capsules of our selenium supplement, not Dox viral defense, 5 capsules of our selenium product that I'm not going to show you here for the first month, 2 capsules for the next second and third week. Or sorry, it was 1 week of 5 capsules. Then it was second and third week was 2 capsules. And then for 3 months after that, it was just 1 of selenium to help with lymphedema. Here's our black cumin seed oil called Nigella sativa oil in our biodefense that we just highlighted earlier. And then the amazing flavonoid called quercetin, which I quote, is a chemotherapy drug. I'm Dr. Ardis. This is the Dr. Ardis Show. This is Natural Solutions to Lymphedema, the incurable lymphedema, which I'm trying to give you as much hope as possible for all of you who are having secondary lymphedema issues, which is the primary cause after breast cancer diagnosis, you name it. Also, in our book, Moving Beyond the COVID-19 Lies, that is still an international bestseller on Amazon in multiple categories, vaccines, and now pulmonary medicine actually is the category in Amazon now. I don't know if y'all know, but I actually touch on lymphedema and its impact of COVID-19, the COVID-19 vaccines on your lymph system. And then the natural antidotes are all listed throughout the book, but primarily summarized in chapter 15. All right, I am Dr. Brian Ardis. I hope you've enjoyed this presentation. It's titled Natural Solutions to Lymphedema that affects 250 million people worldwide and more than 10 million Americans. I'm Dr. Ardis. God bless. We'll see you next time on the Dr. Ardis Show. Have a great week. Thanks for watching this week's episode. Visit thedrardisshow.com/follow for my official social media channels and free healing resources. Beware of fraud accounts. Neither I nor my company will ever ask you for money, crypto, or personal information through your social media or DMs. Like this video and share with a friend. And if you're not already, subscribe and follow along so you don't miss any updates from me, the only real Dr. Brian Ardis. And remember, nature always wins.
Disclaimer. Please note, the following presentation is solely for informational purposes and should not be seen as a replacement for advice provided by your physician. It is important not to rely on the information from this presentation for diagnosis, treatment, medication prescription, or any other form of medical care. Always consult with your physician or healthcare professionals before taking any medication, nutritional supplement, herbal remedy, homeopathic treatment, or pursuing any health-related procedure. If you have a medical condition or believe you might have one, promptly contact your healthcare provider. Do not disregard professional medical advice or delay seeking it based on this presentation's information, as the products or services purchased from it Do not establish a doctor-patient relationship between you and any affiliated physicians. Statements about dietary supplements have not been evaluated by the Food and Drug Administration and are not intended to diagnose, treat, cure, or prevent any disease.